Welcome to the Just Ingredients podcast. I'm Cara Lynn, and here we talk all things nourishing to the mind, body, and soul. This is a place where you can find just good ingredients to life. Welcome back to the show, everyone. I have been looking forward to this conversation for months, and today we are finally making it happen. I have Dr. Tyna Moore, a licensed naturopathic physician and chiropractor with nearly 30 years in holistic regenerative medicine and metabolic health. She focuses on treating root causes, not just symptoms, known for her expertise in peptide therapies like semaglutide and Ozempic. Dr. Tyna is a strong advocate for medical autonomy and empowering others to achieve lasting health and wellness. And so I am asking her all of your questions that you have had for me. I'm asking her. And so welcome to the show, Dr. Tyna.
Thank you. Thanks for having me on. I'm excited to be here.
Well, before we delve into the GLPs, will you just give my listeners a little bit about your background or tell them a little bit about yourself?
Yeah, sure. So my background goes back decades, like you mentioned. I've been in this space a long time, and whether I was working as a receptionist in a naturopathic doctor's office or whether I was licensed physician myself, I've kind of seen it all come and go. And my specialty in clinical practice was regenerative injection therapy. So as a chiropractor, I'm highly skilled in musculoskeletal medicine, and then I would utilize natural substances and sometimes the patient's own body fluids like platelet-rich plasma, stem cells to regenerate their joints. So more of an orthopedic slant. But in that, I did a lot of bioidentical hormone replacement because pain and healing are intimately related to our hormonal milieu. So lots of experience there. Peptides came on the scene many years ago, and obviously regenerative properties of like BPC 157, TB 500, some really great peptides out there. And then more recently, how I got involved in the GLP-1 conversation was just over a year and a half ago. My podcast producer for my show was bugging me to do an episode about Ozempic. And I really am not a big fan of talking about weight loss. I know it's a big topic and people really get into it, but my slant has always been get strong and forget skinny, because I grew up I was like a skinny anorexic girl my whole life. So when I found strength training over a decade ago, it was world changing. And I was way back in the day when the influencers were telling you to, do yoga and eat plant-based diet. I was like, eat steak and deadlift, so
That's awesome.
this, yeah. So I've been beating this drum a long time. Muscle strength training, it's non-negotiable. That has always been my phrase and the way that I've come at this. So, people are like, well, how did you get involved in GLP-1s? I started researching them for my podcast, and I realized that outside of the diabetes and weight loss conversation, they do a whole lot more inside the body that is regenerative, healing, and anti-inflammatory from like tip to toe. And most interestingly, in the brain and its impacts on neuroinflammation and pain. That's what really got me excited because that's my background. Like that was my whole world clinically. So I just kind of I went into the rabbit hole of research and started finding some really interesting stuff. And so I started talking about it, and it really snowballed, and here we are. So that's kind of how we got here.
It has snowballed. You've been on a lot of podcasts, but such interesting info. But like I told you before the show started, I have so many followers asking me questions about GLP-1s, and I'm like, you know what? I'm just going to bring an expert on to answer the questions. But I want to start like at the very, very basics before we delve into, all the questions. So
Sure.
can we just start with what is a peptide and what is GLP-1?
So peptides are strings of amino acids. And the way that we use them clinically and therapeutically is that they insert themselves where they need to go and they get the job done. In the case of like, we have some growth hormone peptides that help signal the response of the body to make growth hormone, for instance. And the way that it works is it will signal appropriately. It doesn't, unlike a medication or a pharmaceutical that we're used to, it doesn't just turn on the on switch and rev the engine and keep, hitting gas to the pedal. It more effectively pulses and gives you the input that you need when you need it. It's just a string of amino acids, and a string of peptides makes up a protein. That's what our whole body's made out of. That's what all our tissues are made out of. So this is really not a complicated molecule. It simply was appropriated by Big Pharma because it was tweaked to have a longer half-life. We make GLP-1 in our bodies endogenously in our stomach, from our L cells. We make it in our brains. We have receptors for GLP-1 all throughout our body for various different reasons that we're only getting to the tip of the iceberg on. And the way that GLP-1 works is it's excreted and then its half-life is very short. It's in and out of the body. It's in and out of use like within minutes. And the way that it is in these pharmaceuticals is that it's been tweaked to have a longer half-life, more like a week.
Mm.
So we just get a longer half-life of the peptide in the body doing its thing. And then my thinking was, okay, so we're using these crazy high doses to impact those who are in a very pathologic state because if whether your listeners know this or not, type 2 diabetes, like you're way down the line of pathology by the time you get diagnosed. It's there has been damage, significant damage going on for 10, 15, 20 years by the time that diagnosis is made. And so metabolically and mitochondrially, like it's a very, you're not to scare anyone, I'm not trying to be a fearmonger, but like it is a very devastating state that we have normalized because so many people are in it in our country and we've exported it throughout the world with our food supply. So anyway, we're using these, the standard is using pretty high doses, starting them pretty high, taking them up pretty high, pretty fast. It's a 16-week elevation of titration up of dosing, and you're essentially doubling the dose every month to get them up to these really high levels. This is for a pathologic state, right? Like extreme obesity, type 2 diabetes. And I was thinking, what if we just like dialed back the dose and did more of a personalized dosing? And you probably heard the term microdosing. I wish I had never come out with that because I would consider it much more at this point a personalized dosing strategy where we meet the patient where they're at and we might have use of this peptide for a variety of other reasons outside of type 2 diabetes and weight loss. And so my thinking was, what if we handled this more like I handle bioidentical hormone replacement and we meet the patient where they're at and we give them the dose that's therapeutic for them. And that could be something as minuscule as, a tenth of the standard starting dose, and it could be the standard starting dose. It really depends, but my goal always is to keep dosages of everything as low as possible. And how we do that is we bring in other peptides, hormones, but more importantly, it's all lifestyle. Like this doesn't replace the lifestyle. This is just an adjunctive tool in a toolkit, comprehensive toolkit. Really, the base foundation of everybody's good health and wellness is the choices they make every day.
Okay, I have so many questions for you about dosing, but before we get to dosing, this peptide has been around for years, right? It's not just something that is new and trendy now. It's new and trendy now for weight loss, but hasn't it been around for years?
Yeah, so they originally discovered the molecule GLP-1 in Gila lizard venom, and so there's all this ridiculous nonsense going around the internet right now, like, "Oh, it's lizard venom they're injecting into you." That is such nonsense.
I just saw a reel of that the other day, to tell you the truth.
Oh, it's such nonsense. So the Gila lizard, they isolated this compound in the Gila lizard venom, and they found, what it did in the Gila lizard, and they were like, okay. So then they isolated it. They realized we make it ourselves. Lots of mammals make it. I mean, this is not like a Gila lizard isolated event. So then it was sort of orphaned. They were actually looking at it from what I understand, for neuroregenerative impacts, and then it was orphaned. And it wasn't until a time later, I think it was Novo Nordisk, one of their scientists went back in and said, "Hey, like, this has really cool impacts on blood sugar handling, and we could use this with type 2 diabetes." And so that was it. The first GLP-1 that went to market was exenatide, and that was 20 years ago. So millions of prescriptions for this is, every couple years we get a new generation of the peptide. We get a new version and it's getting more and more tolerable. It's getting, the dosage is getting easier. It was one of those things where you had to inject yourself every day and obviously compliance would be low for that. And so we're seeing these newer ones that are getting a little bit sexier, cleaner, easier to deal with on the symptom side. And so that's where we are with semaglutide and tirzepatide. And then they discovered that it induced weight loss in the type 2 diabetics that they were using it on. And so then it got FDA approved for weight loss. So here we are. And it was not until honestly the weight loss conversation came up that everybody started losing their minds, which is really interesting when you think about it. Like, what is that saying, right?
And why did everybody start losing their mind over that?
It's been so interesting for me because I was somebody who pushed back really hard in 2020 against what was going on. I'm in Oregon, and I do not believe that we were being told the best advice on how to improve our health and public health measures. And so I pushed back pretty hard, and direct I have endured a lot of
You have.
direct activity from the censorship industrial complex. And so everything from really most interesting part about that was the bots that would come in and just parrot the same phrases over and over, like 2020 through 2022. It was just a
Yeah.
constant barrage of bots. And I saw the exact same thing happen when I started talking about GLP-1s.
Oh, interesting.
I still get them. It's so interesting, and when you go to these pages, these Instagram pages, they're all bots. You can tell there's no photo, they're not following anyone, they don't have any followers, and they don't have any posts. And so I was like, "Well, isn't that interesting?" So you know me, I'm insubordinate to the core, so I just kept pushing, and the more people pushed back, and it was a barrage of pushback in the beginning, and I was like, "Dude, I cut my teeth on COVID."
Yeah, you were like, "I'm used to this."
I'm like, "Bring it on."
Yeah.
And when I heard, what really got me going was when I heard all of my functional medicine friends who are on like Team Freedom parroting what the mainstream media was saying about these peptides. That's when my ears perked up because I was like, this sounds like propaganda. What's going on here? And so I don't know. Anyway, you know me, I'm a punk rock girl. I just like to dig in and I like to stir the pot. So I dig in with research. And when people come at me, it just kind of creates a monster and I come back harder with more research. So that's honestly, it was like a game of like endurance in the beginning. I was like, "You guys are really pushing back. Something is going on. Something nefarious is going on, in my opinion."
Interesting. So
And
interesting.
I think there's a lot of fatophobia. I think there's a lot of people who have something to lose if these peptides really do work as well and are as safe. Done in a more personalized dosing, the long-term data is showing some really incredible impacts, even anti-cancer benefits potentially.
Wow.
So, and that's correlative, not causative. So I'm not, but the studies that have come out more recently, some really interesting, great data around osteoarthritis, around alcohol, abuse syndrome and alcohol cessation, drug, cessation. So if that's true, there's a lot of industries and a lot of people out there, including many in the functional medicine community, who would rather sell you the supplement instead and, their program. I'm like, I'm over here saying, why don't we do all of it? Like, why don't we, if we're smart as healthcare professionals and we really care about our patients, my argument is why not learn as much about it as you can because it's not going away and we're going to have clients and patients on it. We might as well know how to work with it and really optimize the patient's overall wellness instead of fighting back and saying, "Oh, it's poison," because it's not poison.
Yeah. So interesting. It's like having another tool in the toolbox to help people with their health issues. So I want to talk to you though about the weight loss side of it because that's what, so many people have questions about. But first up, dosing, like you talked about, when you go to these med spas and stuff, they just give you an automatic dose and it's not individualized. So how do people, if doctors aren't willing to talk about GLP-1s or don't, support them, how do people even know what or how to dose?
I know this is tricky. So I have a course that I created that I've spent all year building out, and I do dive deep into it. It is for healthcare professionals. The course is geared towards healthcare professionals. It's 30 some hours of content. It's beefy. But I do let the general public in because there are so many smart people out there who want to empower themselves through education. And so I try to talk about it as best I can in there. I will say that there's a lot of folks now jumping on the bandwagons claiming to be microdosing, a lot of telemed companies, a lot of medi spas, a lot of doctors that I know personally. And when I find out their dosing strategy, they're just dosing the same standard dose, starting dose, and they just keep people there, or they might bump them up to the next dose. So they're, in my opinion, they're still starting most people way too high. And now that depends on the person's weight and overall metabolic health, their age, their gender, their size, their how metabolically compromised they are, what their overall hormonal status is. I mean, there's a lot, how much muscle they have, how active they are. All of those factors tie into what the appropriate dosing strategy is. And then once you figure out where to start them, it's like, where do you take them? And how long do you keep them on it? And do you cycle? Do you rotate? Like, what's the strategy there? That's what I talk about inside my course. And I unfortunately can't give you any better answer here today than it depends. It depends on the person and it depends on so many factors that I take into consideration. And then it's to in my opinion, it's really up to the individual to educate themselves. That's why I'm letting the general public in my course for right now, because it's about half and half in there. I just got a message from a 66-year-old woman yesterday that was saying she's been sick and had health challenges her entire life. This was the best money she's ever spent. She's just a lady. She's not a doctor. And that it really, like, it empowered her. And then in there, she found, I have a list of practitioners in there that are in the course that they're allowed to add themselves to the list. And so she hooked up with one of the naturopathic doctors in there, and she said her whole life has changed and her health is the best it's ever been. I got another message from a lady this morning saying, "Thanks to you and your work, my neck pain was 95% all the time, and now it's down to 5%."
Oh, interesting.
So the use of these peptides in a variety of different ways, some people are figuring it out. I highly suggest trying to find someone to work with. I'm trying to train as many doctors as I can, as fast as I can, and my best advice is if you go to one of these places and you start having terrible side effects, your dose is too high. I mean, that's it, simplicity. Like, we titrate up minimal viable dose to get the results we want, short term and long term, and then we don't need to overdose people. And that really depends on the person sitting in front of me, because one person of the same size and stature can handle a totally different dose than someone else. I think there are functional deficiencies. We have data to show that those who are type 2 diabetic and have fatty liver are GLP-1 deficient. And we have data to show in a study that came out a few years ago in obese patients, their natural endogenous GLP-1 response to protein was the same as their lean counterparts across the board. But when you fed them carbohydrates, they had virtually little to no GLP-1 response, whereas their lean counterparts did.
Mm.
GLP-1 makes you feel fuller longer. It's a appetite. It works in the brain in a myriad of ways, but one of them is to control appetite. And so that tells us that obese folks are not handling their carbohydrates the same as a lean counterpart, right? Really interesting there. So I argue for perhaps a functional deficiency. We also could consider that a lot of people have terrible gut issues. Like, most of my patients had leaky gut. And if this is being secreted endogenously in the gut to be used in the gut, then the gut health of the individual must be taken into consideration. As we age, our gut lining atrophies, as does everything in our bodies. So, there's a lot of factors to consider here. And I think that this one size fits all model is got to go. We've really got to get the medical industry to embrace a more personalized dosing strategy.
Okay, so I have questions about this. So it tells the brain or helps you feel fuller longer. So I have a lot of friends that have been on it, tried it, still on it. And the two things I hear all the time is one, I'm never hungry. So then I'm thinking, are they getting enough nutrients? And then
Yep.
two is they say they're nauseous all the time, so they don't want to eat.
I think the dose is too high. I think in most cases, the dosing and management is off. That's the
So
problem.
you
It's not
shouldn't feel
the
nauseous.
No, it's not the peptide. It's the dosing and management. Now, some of us, so your nausea center in your brain has GLP-1 receptors in it. So I do think some people have a higher bed, if you will, of receptors, of GLP-1 receptors. I'm just guessing, just based on how people are reacting. This is theoretical. So I think that this peptide could make some feel more nauseous than others. Now they're coming out hopefully soon with some variations of these peptides, like newer generations of them that have different ingredients in them that should help with that problem in particular. But I don't think we should be crushing people's appetite by any means. I think that's a dosing problem. The goal for me and part of my dosing strategy is really just to help folks gain the onus of control over their appetite. So we want appetite control, not appetite crushing.
That makes
This is
sense.
that's and that would be with anything we're taking. Think about any I mean, shoot, something as simple as an antibiotic. I cannot tell you the amount of times that the standard dosing strategy with an antibiotic was not appropriate for the patient in front of me. And not that I hand those out often. I'm a naturopathic doctor, but when I got to use them, I got to use them. And I have a license to prescribe and I'm not afraid to use it. But I've had to have their dose, just because they were not responding to that high dose that the algorithm said to take. And they did much better. They still got the results we wanted, and we did not make them sick as a dog in the process. And so I look at this the same way. It's so weird to me that the general public at large wants to blame the peptide for what the dosing and management is doing, you
Yeah,
know?
that is interesting. Okay, so But I've also heard that these peptides inhibit like the us absorbing the nutrients. So is that not true? That is just purely people that aren't eating enough.
That's people who they're becoming malnourished from appetite suppression, and in fact, it slows down gastrointestinal motility. Some would argue, "Oh, what if they have SIBO or they have gut issues? You're gonna make it worse." I have a lot of folks coming back. I mean, it's not just my patient base, it's the hundreds of thousands of followers I have who tell me I get floods of messages every day telling me about their experiences, and in some cases, they people need that slowing of gastric motility because they've got more of a diarrhea IBS, and food's just ripping right through them. In those cases, I've had multiple people tell me it actually helped them overcome their anorexia that they had a lifelong problem with. It helped them, get stronger, almost having an anabolic-like effect, because we know that in the muscles we can get to the whole muscle conversation. I'm sure you're gonna ask me about that. We'll talk about that then, but just being able to have your gut heal. The gut lining tends to want to heal up on these. The gut microbiome shifts to a more favorable, less pathologic biome. So people's IBS often improves significantly. And as such, they would theoretically absorb better, right? If we don't have as much inflammation in the gut lining. And if food is staying there a little bit longer and having a longer chance of being absorbed. So it's kinda like we can argue both sides. It depends on the individual and how they respond.
So why is there so much fear out there about the gut paralysis? Because that's like one of the number one things you hear. Oh, Ozempic, all of this is causing the gut paralysis. This is going to cause issues way down the road.
There is no long-term gut paralysis. It's simply, again, a dosing problem. It's twofold. It's a dosing problem. They're dosing them too high. Once the GLP-1 is removed, gut motility returns just fine. It's not there's no permanent paralysis. There's no case of permanent paralysis. The caveat is in type 2 diabetics, that is the one group of people who is most likely to have gastroparesis. And so what's happening, I believe, is that a lot of folks with type 2 diabetes and even prediabetes, which is 97% of the US
Oh,
population,
wow.
by the way, 96, 97. I mean, the last data showed 94%, but that was pre-COVID. So I'm gonna guess higher. I'm gonna go a little bit higher. And based on my patients, it was about 97% of people. And most
That's
everyone who
ridiculous.
this was 20 years ago.
Wow.
Every single lab I ran, I couldn't believe it. I ran metabolic markers on every patient that walked in the door starting in 2008, and my mentor was always like drilling this into me that you gotta get people's metabolic health in order, otherwise they won't heal and these injections won't take because the injections are contingent on your ability to heal. So I was running metabolic markers on everyone, and I couldn't believe what I was seeing. Like easily 80 to 90% of people when I first started in practice. By the end, I was just shocked when we had normal labs. If we had and these were healthy people. The only people I would agree to treat were like healthy, fit people because those are the only people who heal well. And my assistant and I would be in shock. We're like, "Oh, they're metabolically sound." I mean, it was like one out of
Yeah, that's
many.
crazy.
So anyway, type 2 diabetics are more prone to gastroparesis because of the hypersugaring of the vagus nerve. As they sit in diabetes land or prediabetes, they have the hyperglycemia going, which is the high blood sugar. This is going on for decades, like I said, and it actually sugars up the vagus nerve and destroys it slowly. So these folks are complaining of symptoms that are related to low-grade gastroparesis, and their doctors are saying, "Oh, you have GERD, you have reflux. Here's some Pepsid. Here's the little purple pill. Here's some Nexium." And really, what's happening is like low-key gastroparesis, and then you give them a whomping dose of a peptide that shuts down gastric motility, and boom, they get thrown over the edge.
Phew.
So I don't think it's any kind of permanent paralysis. We have no data to show that it is. In fact, studies are showing within a few weeks, once that peptide's out of your system, everything returns to normal. It's a matter of, I think, too high, too fast on dosing in a population that's already sitting on the edge of gastroparesis.
Interesting. Okay, so another side effect that you hear about all the time is people are saying like, "Oh, you have to sign on the paper that you may get thyroid cancer from this, and you guys are crazy for signing that paper knowing you might get thyroid cancer." So where does that all come from?
The latest data, they're looking at long-term meta-analysis. They're looking at data banks of patient charts. And what's come out in the last 6 months is that there's just not seeing it. We certainly have no causative link, and even the correlative link is just not showing that. The reason there's a black box warning on these peptides, which is interesting because there's not a black box warning on some of the other interventions that are being forced upon people in the last few years, but there is a black box warning on this, and it was a study done in rats. It's not in humans. They don't have a human link. They have a rat link. And in rats will I used to have a lot of pet rats, so this was interesting to me. I grew up with pet rat. I know it's weird, but they're really cool
That is
pets.
odd.
They're really cool pets. They're actually a doctor told my mom
Yeah.
to get me a pet rat when I was a kid.
Oh,
Be
boy.
I know, because I had ADHD. They didn't know what to call it back then. They called it, hyperkinesis, but he was like, "Get her a small pet," and rats are highly intelligent, so I ended up with a pet rat. I know it freaks people out,
Uh,
but rats will develop spontaneous medullary thyroid cancer just spontaneously. And so in this study, these rats were given super high, super high doses of GLP-1s, way higher than human dosing. And some of them developed spontaneous medullary thyroid cancer, and some in the control group did as well. So they slapped a black box warning on it, and that's it. That's where we're at with the thyroid cancer. We have no distinct causative anywhere. In fact, again, the GLP-1 studies coming out more recently are showing potential really protective impacts on 13 different types of cancer that are obesity related. So again, correlative, they're looking at patient charts and they're looking at people who were on GLP-1s for a long period of time and people who versus people who weren't. But I think it's leaning the other way. I am not concerned with the thyroid cancer. If folks have a history of it, if folks are, I'm not giving anyone medical advice. Obviously, always talk to your practitioner. If you have a history of it, family history of it, if you're concerned about it, this is a risk tolerance issue. But I will tell you what will give you thyroid cancer: obesity and
yeah.
type 2 diabetes. Those are the two groups that have the highest risk of thyroid cancer, period. So if you have type 2 diabetes, like you have a extremely high chance, like a 2 times risk increase of developing thyroid cancer down the line, as well as pancreatic cancer, as well as liver cirrhosis and liver cancer. So obesity and type 2 diabetes lead to a whole host of really terrible outcomes and pathologies. And so I always talk to patients like, this is what you got to do. Here's the data, here's the real data, not the hype and the scare tactics. And then what's your risk tolerance? What do you want to do based on your personal history and your personal family history?
Yeah, pros and cons always due to their health, issues. Okay, so just last night, though, I saw a doctor doing a reel saying, "Get off Ozempic. We're now finding out that it causes breast cancer." Where does that even come from?
um, no. It doesn't. In fact, type 2 diabetes, in my opinion, and blood sugar dysregulation is the biggest driver of breast cancer. So I no, that's the thing. It's like people aren't looking at the actual sequelae and the true root causes of so much of what is plaguing us as a society. So I'm not saying GLP-1s for everyone and it'll fix everything by any means. I'm not claiming that. But if you can reduce your metabolic disease risk, you are definitely going to be reducing your breast cancer risk. And we have no data to show that these cause breast cancer. We have no data. People take these studies and they don't know how to read them, or they read what they want to read out of them and then they just start going on the
Yeah.
social media. So I don't know where that they're pulling that from. I've heard that a few times. I've looked and looked. I do not know where they're pulling it from. I'll keep looking, but that one keeps popping up as of late. And I think again, it's just people parroting what they're hearing
Yeah.
without fact checking anything, which is so funny. Like I was the queen of misinformation. I was like labeled the misinformation queen for the past 5 years. And yet here I am like, why are these people spreading misinformation?
Oh, that's so funny. Yeah, you were amazing during COVID. I'll just plug that little side note in. You stood up for a lot of things when people were not kind about it, that's for sure. Okay, but let's go back to these GLPs and muscle loss because, like you said, that's a number one thing people are talking about. They'll say, "Oh, you lost weight because you lost your muscle mass. You didn't actually lose fat." And so, what's the concern there? Are we really losing muscle if we take it?
It depends on the dosing and the management. Again, the muscle loss is actually lean mass loss. They were looking at lean mass loss in these studies, and muscle is but one component of lean mass. So it's not all muscle. And that's a differentiation that needs to be stated because we might have fat in our liver, we might have fat in our pancreas, we might have there's other tissues that might be boggy because of the high insulin and the insulin resistance that are holding onto water. And so when they're weighing that, they're seeing a decrease. Um, The loss of lean mass, though, is on par with any severely calorically restricted diet. So if you put somebody into a severe caloric state, low caloric state, like you would with a bariatric surgery or just even inducing a very low calorie diet for a study, you're going to see it's on par 20 to 25% lean mass loss. I know in some cases they found even up to 40%, but again, I think they were slamming these people with really high doses and titrating them up very quickly. And so when you stop eating, you become malnourished and you lose muscle. In fact, the way that muscle is lost, there has been some studies that were really interesting, and not to nerd out too much, but losing muscle isn't entirely the worst thing. It's losing strength that we're far more concerned about. And so I think we need better studies, and they really need to look, because the original studies, they weren't having people exercise. They were just cranking them out on GLP-1s and going, oh, look at the before and after. And we need to be obviously prioritizing protein. And I'm sure as a woman of similar age, like that's like a daily full-time event at this point. It's like
Trying to get
hitting your
enough protein in.
I know it's exhausting, but the protein, the strength training, all the things you should be doing anyway, right? Like those are the number 1 and 2 when I have a patient in front of me who has weight to lose or who has type 2 diabetes or any kind of metabolic dysfunction. I'm like, we need to strength train and we need to eat more protein. I mean, so this isn't anything different. And I don't think that patients are really being counseled in every case. You know, Medi spas, some of these more allopathic doctors are just throwing them out. I do think doctors are getting more savvy, and what we need when we're trying to induce weight loss. Again, this is a entirely different conversation, because what I was finding for GLP-1s really was a whole host of benefits. We've got studies on cardiovascular, we've got studies on brain health, we've, Parkinson's, Alzheimer's, like I said, addiction, abation, all kinds of things. But over here in the weight loss community, that's what everybody's hyper obsessed about. I think at the end of the day, you're going to get that kind of lean mass loss if you go into a low calorie state, regardless of GLP-1 use or not, is
So
the bottom line.
so the GLP-1 is not attacking the muscle or anything. It's purely that you're eating less calories every day because of the GLP-1, therefore you're losing the muscle.
Yeah, and then a lot of folks will just eat less of the same garbage food that they've always been eating. So instead of crushing a bag of chips, they'll just have a handful of chips and they call it good because they're full. And it's just a disaster, you know? So counseling folks on how to eat, counseling folks on how to move, how to lift weights, bringing community into these programs, bringing accountability, and like creating a holistic group, health coaching. I think there's a lot better ways to do this. And the muscle component, in fact, GLP-1s are actually anti-inflammatory, healing, and regenerative to muscle, and maybe anabolic. They help with they looked at elderly gentlemen. They help with hyperperfusion of the muscle. They bring in more blood flow, which would mean more amino acids, which would mean more muscle protein synthesis. And my fit folks, my really fit folks who are using GLP-1s for other reasons, for neurologic reasons or for whatnot. I've got my husband on them because there's a heavy cardiovascular history in his family, and I'm just using it preventatively. Um, in those populations, those people are reporting that it actually gives them the same kind of pump that being on testosterone does. So
Interesting.
yeah, because they're like, A, I'm absorbing more nutrients. I can eat more foods because my gut isn't so inflamed. So I'm able to actually branch out a little bit and to eat a wider variety of foods. And then C, there's something happening. And I think, again, we have to look at the pathologic population versus the healthy fit population. My whole argument with these initially was use as an optimization tool in an already healthy, metabolically well cohort. People like me, people who lift weights, people who are lean, people who are healthy, people who eat the right food and do the circadian rhythm and, do all the things. In this group, we can use tiny little minuscule doses to really dial some things. And for me, it was brain fog, cardiovascular support, immunologic support. These things actually have there's some really cool data around autoimmune disease and what they potentially are doing. There's GLP-1 receptors on our immune cells. My personal experience, my patient's experience, and the multitude of reports I've gotten from my followers are mind-blowing and I'm not making any claims, but what I'm seeing is that, and what I'm hearing is that reversal of some pretty severe autoimmune conditions, or at least keeping the lid on the pot and quelling the response down. It's amazing. I've never seen anything like this. There's no tool. I've been using low dose naltrexone with patients for 20 years. I've never seen a tool like this work so quickly to just calm down the fire in an autoimmune patient. So, in those folks, we just need tiny little doses because they're already metabolically optimized. The microdosing, the low dosing, that's not really a weight loss strategy. Over here in the weight loss land, we're dealing with an entirely different patient cohort, if you get what I'm laying down.
Yeah. So interesting. Let's take a quick break to hear from our show sponsor. You have probably seen Ilia's award-winning Super Serum Skin Tint with its iconic bottle and dropper all over social media. It feels like every influencer is talking about it. Ilia is the OG of clean, thoughtfully formulated products that are super hydrating to improve your skin over time. Ilia's Super Serum Skin Tint with SPF 40 is the #1 best-selling foundation. A clean skin tint with light, dewy coverage and active ingredients like niacinamide, hyaluronic acid, and squalane. It truly makes your skin feel alive. The best thing is you can submit a selfie on their website and a real human will shade match you with one of their 30 shades, and they have a 96% success rate with this. So try it for yourself. Visit iliabeauty.com and use just ingredients at checkout for 15% off your first purchase. That's ILIA beauty.com with code JUSTINGREDIENTS for 15% off your first purchase. Now back to the show. Okay, so you were talking though about the bag of chips, and that made me remember I have a friend who told me that being on a GLP-1 has really reduced her cravings, her sugar cravings, and also has calmed down her mind of always like she was constantly thinking how many calories or how much food she was eating or what she's going to eat next and how much it was going to weigh. And she's like, it's calmed my brain down and calmed down my cravings. And why is
Yep.
that?
Because they work in the brain on the dopaminergic pathways, the reward pathways, and they also work on the serotonin pathways. They do some crazy things that we don't totally understand, and they calm down neuroinflammation. So a lot of folks will report diminishing of the noise, and some wanna call it food noise, but for me, I never had food noise. I had, like, different kinds of chaos noise. I had other things I ruminated on. I had other things I would let loop through my brain and keep me awake all night, other things that caused me anxiety. For instance, I used to be my entire life, I'm 50, I am an overpacker. I wanna hoard and I wanna overpack. That's what I wanna do. Since being on GLP-1s, I fly probably once or twice a month, and I only one time have taken a checked bag. Only once. I don't know why. I can't tell you why, but I can tell you it's the GLP-1. Because without the GLP-1, that rumination comes back and I'm like, well, I have to have everything just in case. Whereas on the GLP-1, I'm like, oh, I just need a couple outfits and I'll be fine, right? I'll just buy what I need if I need something. It's like an entirely different shift in cognition. It's wild. You can go too far though. Just the slightest bit too much can be too much. And this is why I'm a proponent of a more personalized dosing approach because in my husband, for instance, if I give him just a touch too much, he'll be like, just lack of luster for everything. He doesn't want to eat. He doesn't want to drink any, he doesn't want anything. He doesn't want any chocolate. He doesn't want to have sex. He doesn't want anything.
Mm.
So we have to pay attention to our patients. We should not be taking these peptides mamsy-pamsy on our own. If you're on them and you're reporting some of the things your friends are telling you, you need to go talk to your doctor about dialing your dose back because it's just not necessary. We don't want to lose all luster for things. I want to touch on this because I think it's important. They have looked at this in its relationship to suicide ideation, and I think that's important because I was somebody who, as a teenager, really was plagued with that. And for me, and what the studies are showing is it actually is an incredible mood lifter. And I think that depends on the dosing. I really think that depends on how it's applied because I have never had something really balance my brain chemistry out and make me feel so normalized and just even keel than I have on a GLP-1. And the studies supporting that as well. And the studies on the long term, the suicide piece, I know that the World Health Organization just came out with a study and everybody threw it all over the internet. They didn't read it. What they found in there is that there was a very small signal up. Several million patient charts were looked at, and they had a very tiny signal of suicide ideation, I think 100 something in the semaglutide group out of millions and millions. And what they found in that group is that these folks were also on other antidepressants and benzodiazepines. So they very clearly stated in the limitations of the paper, like, A, take this with a grain of salt because maybe these people came in depressed. Maybe they came in already. I mean, already they're obviously on benzos and antidepressants. I mean, there's obviously something going on there. So really the message of the paper was screen your patients, not discontinue GLP-1s, but screen your patients. I will argue that maybe these folks, a couple things, they probably were given too high a dose. And then secondly, if food is your dopamine dragon, like if
Mm.
food is the way that you self-soothe and now you've taken that person's appetite away and desire for food, of course that's gonna I mean, they don't have their crutch. They don't have their tool to self-soothe. And I'm not this is not a judging statement. I use exercise to self-soothe. And when I can't exercise, I go nuts. I mean, I feel this last couple weeks since I told you I had a procedure, I haven't been able to work out and like I can't self-soothe. So I understand how that could be a component, but the message of the paper, the conclusion was screen your patients. This is too low of a signal to be concerned about, but we want to make sure that we at least mention it, that it could be a signal. That's all.
Okay, good to know. But since it does help with serotonin and dopamine, it could possibly help those that are dealing with depression.
Yeah, I think so. And I think we need more studies. I have had many people reach out to me and say that they were able to discontinue or significantly lower their dose of their antidepressants and that it's just been a godsend. One little shot a week and they can function in the world. Whereas before, lifelong history of low mood and depression. It's really phenomenal. The other piece is there's actually going back to COVID, there's some really compelling data showing that it might have a protective measure against COVID and upper respiratory and pneumonia. And so I think that there is a potential not only like mood boosting and it lowers anxiety, it boosts mood, but it may be protective against upper respiratory season,
Wow.
if you will. I'm not again not making claims. I'm just telling you what pieces of data have said. They had one study in the Journal of Diabetes that they looked at a small cohort of patients who came in to the hospital, type 2 diabetics. They came in and they were administered semaglutide. I don't think they were previously on semaglutide. I can't tell by the paper, but they were administered semaglutide, 80%, 80% reduction in ICU admission and death.
Oh, wow.
So, just I throw that in because I know that a lot of people's anxiety and, mood changes have sort of stemmed from the past few years, and we've been programmed into a fear state by what's going on around us, and so, it's just interesting when you asked earlier, like, why don't people want GLP-1s out there. I'm like, I don't know, but there's a lot of factors here that
Yeah.
it gives the person the onus of control back. It makes them feel more in control of their choices, what they put in their mouth. The snack food industry is concerned. They have come out and said that very clearly multiple times. And we maybe are potentially crippling the diabetes industrial complex, which is a very profitable industry. Like there's a lot of money to be made off of the majority of American adults dealing with metabolic dysfunction, right? There's dialysis clinics, there's joint replacement companies. There's a whole lot going on there. It makes you not want to smoke cigarettes. It makes you not want to drink alcohol. It's like, and it might protect you
A l
immunologically.
a lot of companies out there might lose a lot of money, therefore, that could be playing a part. We could do a whole episode just on that, but we'll leave it at that.
We'll leave that part off the internet. Do
Exactly.
not do not put that on social media.
Okay, so I have another question, though. Once you're on it, are you always on it for the rest of your life?
That's a great question. I think it depends on the person. So for me, it has been so profound. My goal is to make sure I'm doing all the other things. I will tell you, you can eat through it, you can drink over the top of it. And so if you're using it in more of a preventative lifestyle optimization, longevity piece or tool, you really have to keep your lifestyle dialed in to keep that dose low. So I will say for me, the way that it impacts my immune system and my mood, I probably will stay on it just like I stay on all my other hormones, and I will cycle it just like I cycle all my other peptides, which is we use them when we need them, we're off of them when we don't. That depends on the person. I can go about 2 weeks before I start to see symptoms of my psoriatic arthritis come back. And so for me, I have found a more regular dosing schedule. For others, they can go off it for a time period and they might use it intermittently throughout the year, depending on the season, depending, because, the seasons change and so does our immune system with it. And so do our hormones. And it really depends. I found over the last year and few months that I've been on it, I have reduced my thyroid, my thyroid prescription that I've been on for decades. I was up to 2 grains of Armour thyroid a day. That's a hefty dose. And I was like, for the entirety of my career, ended up needing more and more thyroid as the years went on, as they got older. And I thought, this sucks because at a certain point, you can't just keep cranking the thyroid, right? And I'm down to a half grain a day. So it's healing. That's the point. It's healing. So I say this because the longer you're on it, my hypothesis is the more healing of these organ systems that it's impacting you're going to have. And so it heals the metabolism. For those who are really metabolically compromised, it's healing their metabolism. It's healing the insulin signaling. It causes the insulin to pulse when it's needed, not just crank. It helps with the reception side of the cell cellularly to hear that insulin better. And we start to heal metabolic pathways, AMPK, mitochondria. We start to heal these pathways. And so for folks who are like, oh, I don't want to be on this forever, it's not just a band-aid. It's actually long-term inducing, I believe, a healing impact on the body.
Okay, so let's talk about the cycling, like you said, because I was at the gym the other day and I heard 3 people talking about it, how they dose it. And one was saying she takes it only once a month. One was saying she has to take it weekly. And the third person was like, oh, I just take it here and there whenever I want it throughout the year. So all 3 are okay?
It depends on what they're using it for and how their body responds. It's so individualized how people respond. So the cycling is, I've got some colleagues who are doing once every 2 weeks. I've had followers tell me that they take it once every 2 to 3 weeks and they've completely quit smoking and drinking alcohol. I've got other folks who will divide up their dose throughout the week and do smaller doses throughout the week. It's all over the place. And the whole microdosing conversation is like the inmates are running the asylum. It's all over. Like what I've seen on TikTok and even with my colleagues, what they think is microdosing versus what I think of microdosing is a whole other conversation. So here's my endpoint. I think the pharmaceutical industry needs to get hip to the fact that this peptide has a potential myriad of opportunities and needs to come up with a more individualized dosing strategy for people and needs to start actually looking at Eli Lilly just released the vials of Zepbound. So with a vial, you need to get it compounded. If you want to do a dose lower than the standard starting dose and you want to play with your dosing, you need to do a vial. And
What is the standard dosing?
the standard dosing is 0.25 milligrams starting dose of semaglutide up to 2.5 over the course of 16 weeks. And with tirzepatide, it's 2.5 milligrams up to like 12.5 over the course of 16 weeks, which is doctors are following the data and the data is saying just double the dose or virtually double the dose every month. And a lot of patients are finding themselves on this journey and they're just up at way, way, way too high a dose and they just feel awful. And it's crushing their appetite. Their hair is falling out. They're wasting away and they look like melting candles, right? And they feel awful. That's not it. That's not what we're going. That would happen if you overdosed. Here's another signaling peptide hormone, insulin. That would kill you. Right. So we have to respect the peptide and we have to respect that its use is going to be different in each individual. And this brings us back to individualized medicine, which is what I've always practiced. That's naturopathic medicine 101. The allopathic community hasn't really caught on to that. They're following the standard of care, and the standard of care says you have to dose this way. And so they get stuck with that because they're afraid. They don't want to risk their license because they have to follow the standard of care. I don't. As a naturopathic doctor, I have license to prescribe. I have to do best practices. And to me, best practices is evidence-based medicine. And evidence-based medicine, if people don't know, is not just the studies. It's not just the data. It's actually the clinician's experience, the patient's experience and preference, and the data. That's the triad that actually defines evidence-based medicine. And so I take that in very much into consideration and I listen to my patients.
Okay, so I have 2 more questions. One, there are a variety of different GLP-1s out there. I mean, you touched upon a few of them, like the Ozempic, the tirzepatide. So do they all have different side effects or different benefits, or why so many different ones?
So semaglutide is the generic for Ozempic and Wegovy. That is semaglutide. That's just a GLP-1 agonist. It means it sits on the GLP-1 receptor and agonizes it. It makes it go. It's bioidentical. It's just tweaked to have a longer half-life. And then tirzepatide is the generic for Zepbound and Mounjaro. Those are the same exact things. One is FDA approved for weight loss, one's FDA approved for type 2 diabetes. So tirzepatide is a GLP-1 agonist and a GIP agonist. So the GIP has more of an impact on your metabolic health and your blood sugar handling. It's glucagons. It's a glucagon stimulant. So what they found in the studies, not to get too nerdy, is we can suppress glucagon or we can agonize glucagon, and in either case, we get better blood sugar outcomes. So they decided in this case to make a GIP agonist. And I have found with tirzepatide, um, to be truthful, it's all over the map. Some folks prefer semaglutide, some folks prefer tirzepatide. Some claim that tirzepatide has less side effects. I think it has more side effects. It really depends on the individual who's using it. It depends on what we're using it for. It depends on short-term and long-term goals. I have found in some, I'll just tell you anecdotally, semaglutide, at least what I'm seeing in my patient base, seems to control the alcohol cravings better than tirzepatide. Tirzepatide, because of that significant impact on the insulin and on the glucagon, we can see some real precipitous drops in blood sugar very abruptly. So for the skinny mini girls who are using it for immune regulation or maybe to get, I mean, I know a lot of women in their 50s who are very lean, very buff, very little body fat, and their labs are starting to edge towards metabolic dysfunction, right? They're starting to get some cardiovascular markers. Depends on their health history of kind of what they're looking at. And in those girls, we'll use very tiny doses, but a little bit too much can be a lot too much in that population. And we'll see, their CGM, all of a sudden their blood sugar just plummets out. They feel like they're going to die. So we have to be very careful and respect the peptide and make this a very individualized approach, because we don't want to be bottoming out people's blood sugar all day long either, for the sake of immunologic regulation,
Yeah.
right? So it's a balance. And I do see that more with the tirzepatide, that precipitous blood sugar drop. So be careful and proceed with caution. Just in that, not caution that we should be scared of the peptide, but just be prepared. And this is where a lot of doctors saying they're microdosing are starting people on the standard starting dose. And it's like, I dial those folks back to a tenth of that dose in some cases.
I was gonna say, so that standard dose of the 0.25 is not microdosing.
Not in my opinion, but in many people's opinion now. Again, like the inmates are running the asylum. So go on TikTok and look at microdosing,
Yeah,
and
no,
it's
I
like,
don't want
holy,
to.
it's chaos. There's people on there that just normal people that have they're just normal people. Like they don't have any health background whatsoever, and they are describing microdosing and telling people how to do it. And it's funny. It's
Yeah,
a comical. It's
that's a
like it's all
little
over the
scary,
place.
actually.
Yeah. I mean, these are for real peptides. Like, I do not encourage people to buy these off the internet and just go have at it. I even know in the strength and conditioning community, I know that they're using this peptide to bring people back from competition. A lot of women, you might know some or have some clients or some followers who did a lot of competition work, like the bodybuilding, the bikini competitions. And those women notoriously destroy their hormonal profile because they get so lean, and they're using GLP-1s to bring them back online, because then they'll swing out of the competition and get this ravenous appetite. So they swing back and forth in their weight, and it's really devastating. And so in these women, I've talked to some of them, and their coaches are administering peptides, and I don't know where they're getting them. And they're really messing them up. Like, they're dosing them way too high, way too frequently. So get with a doctor or somebody who knows what they're doing.
Yeah, you've got to work with the doctor, because I do know someone who gets it from a med spa, and she literally looks anorexic now. Like,
Oh, it's terrible.
I'm like, I
And
can't be healthy in the long run.
there's good coaches out there too who really know their biochemistry and are good at this kind of thing. So I'm not negating all the other health professionals out there. There's a lot of really, I mean, shoot, I know health coaches that are 10 times smarter than most of the doctors I know.
Yeah.
So it really just depends on who knows their biochemistry and understands endocrinology and what they're doing. And I'm not saying I always get a prescription, though. I will say that. Get a prescription of it and make sure that you're working with a team or somebody who knows what they're doing, so you don't just destroy yourself. Because if you go too far, I'll just say this quickly. If you go too far into the muscle loss and into the weight loss, and you really crush your appetite and you really, really crank that dose up, and these people, like you said, they look like anorexic melting candles, they're destroying their metabolic health.
Yeah.
So they come into it with compromised metabolic health, even severely in some cases. And then they come out the other side just destroyed, because they lost the only metabolic engine they had, which was the little bit of muscle they were carrying. So now they're underweight and they think it's great because they're thin and not obese, but they're just destroyed. And coming back from that is like, I don't even want to think that's like no man's land. That
Yeah.
we do not want anyone going there.
Well, can we end on this one last question? Is this everybody is looking for the magic pill out there. And I feel like this is a tool in the toolbox for some, but you still have to live the healthy lifestyle of watching your sleep and what you're eating and all of those things. Correct? Because I have a friend who's on it and she is like, this is not working. I haven't lost any weight, but I do know what she eats. And I'm like, well, maybe it's because of what you're eating and you're not working out. So there is
Yes.
the lifestyle component still, right?
It is not a substitute. It is not no, it is not a substitute. It's awesome as an adjunctive tool when you just like any peptide. I'll say this, peptides are really cool and helpful when we wanna give someone a leg up for various reasons, but they don't work that well in people who eat like garbage and don't exercise and don't take good care of themselves. They work really well, like, it's a gift. Peptide I look at peptides as a gift to those of us who do the work. Those of us who are putting in the work, we just need a little sprinkle. It's like that Salt Bay, like, little sprinkle of this, little sprinkle of that, little sprinkle of hormones. Everything works really beautifully in those patients. In those who are a complete train wreck of health and continue to persist with those lifestyle habits of train wreck, these peptides are you're gonna hit a wall. You're gonna hit a wall with your hormones. You could spend all the money on bioidentical hormone replacement. I've seen this countless times in my decades of medicine. They hit a wall. Within 90 days, they hit a wall and they get no further. And now it takes more and more and more of that peptide or hormone to get them any kind of results and move the needle. And it's just like trying to hit a moving target. It's a disaster. So no, there's no substitute for good, clean living. Your foundation of your health house is based on your muscle mass, your sleep, your mental state, your ability to manage your stress, your nutritional status. We need to be eating highly nutritious, dense, and nutritiously dense foods in a variety of colors and formats. We need to be getting enough protein and healthy fats. And that's it. Like, and we need to be getting sun and light and circadian rhythm balance. Like, without those, nothing's gonna work.
Yeah, I'm glad you said that. Well, thank you so much for being here. We didn't even touch upon so many of the questions. So if you guys have more questions about this, follow Dr. Tyna Moore because I do know I have a lot of people that are in my stage of perimenopause, and I know you've talked about GLP-1s helping with hormones and things like that.
Yes, thank you. I think it is the perimenopausals BFF.
My followers are gonna be like, "Wait, she said that GLP-1s are perimenopause girls' BFF." So really quick, is it just because it helps regulate that insulin resistance, which causes a huge issue with our progesterone and estrogen?
Yes, as we age, we become more insulin resistant no matter what. Even with our best intentions, we will become insulin resistant to some degree, if not severely. And I think that is due to a myriad of factors. I unfortunately think it has a lot to do with how we lived our life years earlier. So even if you're like me, I mean, I was a train wreck. I chain smoked, I drank like a fish, I was a mac and cheeseitarian. I was a disaster in my 20s. I did not start strength training until I was 40. And unfortunately, when you hit around 50, late 40s, 50, those teens and 20s, they come back to haunt you. And so I think a lot of us are sort of looking at insulin resistance in the face, and that comes with the middle-aged middle out of nowhere. Like all of a sudden, I'm like, where did I get this 15 pounds around my midsection?
Mhm.
The GLP-1s help with that tremendously. And I'm not saying they make it go away because, again, I can eat right through it. I could drink right through it and continue. My body just wants to make me into a potato shape.
Yeah,
That's
I
just
I get
that's
it.
just so I think that GLP-1s can be a really beautiful part of a triad. To me, it's strength training, bioidentical hormone replacement, GLP-1s. I think it's a really beautiful triad for the middle-aged woman.
Oh, we need a whole episode on perimenopause. There are not enough
Yeah.
people out there talking about that and how insulin resistance is a huge key factor, and we need to talk about insulin resistance. We need to do a whole show to help the women.
Yeah, I just gave a talk in front of a medical community on this exact topic because I think that the argument is always, oh, the waning estrogen is what's causing the all of the downstream problems. And yes, that is true, but also the fact that we go from a gynoid body shape, which is the curvy hourglass, into an android body shape, which is the androgen heavy body shape, which is the potato, the apple, but I call it potato, but others refer to it as the apple shape. I think that's also driving all of these conditions. And I wish it were as simple as just building muscle. I wish it were as simple as just going hardcore with your HIIT training. I wish all of these influencer doctors who seem to have the answer. And I'm here to tell you it's all of those
All of
things.
them.
Like, we have to do all the things. And I'm over here with a little bit of GLP-1, like, hey, I have a really helpful tool we could throw in the mix. And so you need the hormones, you need the strength training, you need the protein, you need the sleep, you need the stress mitigation. I think a lot of these messages that are getting out are so hardcore. And I'm a bit older. I'm 50. How old are you?
I turned 50 this year, so
Oh, beautiful. Me
yes.
too. Oh, you're so beautiful.
Well,
Good
thank you.
job.
You are too.
Thank you. Um, thank you. We deal with a bit older audience. I have a lot of folks in my following who are in their 60s, 70s, even 80s, and they're just these are women. A lot of these women are on their own now. Their husbands have passed and they're ready to re-embrace their health.
Mhm.
And some of these messages are just way too hardcore.
Yeah.
I'm just sorry. I just can't. I'm like, dude, we don't need to be crushing it in the gym all the time. We need to build muscle. We need to respect our bodies. We need to respect where our hormonal milieu is. And we need to use the tools that we have available. A lot of women have pain, a lot of pain, which inhibits them from doing all of these things we're supposed to be doing. We don't need to be ice plunging in 32-degree water. Like, we just need to just chill out a little bit. And I'm for comfort in this phase of my life. I I wanna stay healthy and hot while still enjoying comfort instead of I was a big grind, in my 40s, I was just pushing it too hard, and I think we need to all just embrace, like, a beautiful aging process.
Oh, I love that. So tell people where they can find you to learn more.
So anywhere at Dr. Tyna, it's DrTyna. So Instagram is my main hub. Although I got deplatformed off there, I think maybe by Big Pharma back in September, and I got my account back somehow. So I don't really talk about them as much on there. My YouTube channel has a lot of information. My podcast, The Dr. Tyna Show, all of that's on my website at drtyna.com. And then I have a free 4-part video series that you can learn more. The part 1, I talk about the different applications throughout the body that we really didn't get into too much. Part 2 is a discussion about dosing. I talk about the big scaries. There's a lot more of them that people are concerned about, like pancreatitis and such. I discuss all that. And then I do have a course that, like I said, it's for now, it's available to the public. We're talking about maybe shifting that just to clinicians only, but it is a clinician course. It is beefy, it is thick and dense. So if you're really smart and you want to be highly empowered and you like my delivery style, that's really the ultimate destination for the information.
Well, you are a wealth of knowledge, and I know I have learned so much from you. So, followers, go follow her. You will learn so much, like I said. And I don't know if you know this, but I end my podcast with always asking my guests what they have found to be the best ingredient in life. And so, what would you say it is?
Salt.
Oh, I have not had that one before. How come?
Salt. Salt fixes everything. So just real quick, the salt is not the problem with the high blood pressure, it's the insulin. So my platform has always been about metabolic health, right? And insulin resistance is a big piece of that. The salt is like I carry a little vial of Redmond sea salt around in my purse, and sometimes I carry 2 because I usually have to gift one out to
Oh,
somebody who needs
funny.
some salt. It will regulate your blood pressure. For those of us who get the low grade POTS and we kind of, get that dysautonomia, which so many people do, especially after COVID, that can be a problem. Salt is the great regulator. If you don't feel well, a little bit of salt. If you feel kind of dizzy or you feel kind of sluggish, a little bit of salt. Like, I just am such a huge fan of a good quality, mineral dense sea salt. I think it fixes everything. I've had people in emergency situations like bleeding out on the curb, and I'm like, here, take some salt while we figure out what to do with your wound and get the ambulance.
Oh,
So
funny.
I'm not kidding. Salt is such an incredible tool that the earth has given us. And I think and it makes everything taste better. So as long as your insulin's in check and you're doing all the good lifestyle habits, salt should not be the problem for the blood pressure.
Thank you so much for being here. I know the listeners have learned a ton. This will answer so many of their questions. And listeners, like I said, go follow Dr. Tyna Moore. She is such a fun follow and you will learn so much. And thank you for taking the time to be here.
Yeah, thanks for having me. This was great.
Thank you so much for listening. Remember to subscribe to the Just Ingredients podcast to learn more about your health and good ingredients to life. Plus, get daily tips at just.ingredients on Instagram.